Hi all, our next topic is diuretics. Diuretics are agents which produces diuresis. Diuretics means drugs which promotes excretion of sodium and water through urine. There are various types of diuretic agents. Some are high efficacy diuretics like sodium potassium 2 chloride transporter inhibitor. Medium efficacy diuretics, these are sodium chloride symbiote inhibitor. Some are weak or adjunct diuretics like spironolactone. High efficacy diuretics are also known as high ceiling diuretics. These have maximum diuretic capacity. Examples are loop diuretics, which include furosemide, bumetanide, and torsemide. Then medium efficacy diuretics, these are thiazides and thiazide-like diuretics. Thiazides diuretics are hydrochlorothalidone, benzthiazide, and polythiazide. Thiazide-likes are metolazone, chlorthalidone, and indapamide. Weak or adjunct diuretics, these agents are not used as single therapy. It is used in combination with either loop or thiazide diuretics. These include carbonic anhydrase inhibitors like acetazolamide, potassium-sparing diuretics like aldosterone antagonist. Some are epithelial sodium channel blockers like amiloride. And the third one is osmotic diuretic, which include mannitol and glycerol. This is the various site of action of diuretics. Carbonic anhydrase inhibitors and osmotic diuretics acts on proximal convoluted tubule. Thiazide diuretics acts on distal convoluted tubule, and loop diuretics acts on ascending limb of loop of Henle. Potassium sparing diuretics acts on collecting duct. The loop diuretic has maximum sodium excreting capacity, and the prototype agent is furosemide. Mechanism of action of furosemide. Suppose this is the thick ascending limb of loop of Henle, and this is the luminal side, and this is the vascular side. There is a co-transporter present on luminal side of the epithelium, which is known as sodium 2 chloride potassium co-transporter, which allows reabsorption of sodium chloride and potassium into the blood. This sodium is reabsorbed back into the blood with the help of sodium potassium ATPase pump. So what will furosemide do? It blocks the sodium potassium 2 chloride transporter, thereby inhibits the reabsorption of sodium and ions. Thus, it promotes sodium chloride excretion. It also allows excretion of calcium and magnesium. The high sodium load reaching the distal convoluted tubule, that will leads to excretion of potassium to maintain electrical neutrality. And these are the various preparations of furosemide. Lasix, which consist of 40 mg of furosemide. They have short duration of action. We also have injection form of Lasix. The long-acting loop diuretic is torsemide. It is given as once daily. Medium efficacy diuretics, these are thiazides and thiazide-like diuretic. It acts on early part of distal convoluted tubule, and this is the luminal side and this is the vascular side. There is a sodium chloride symporter in the luminal side of epithelium, which allows reabsorption of sodium and chloride into the epithelium. From there, it is reabsorbed into the blood with the help of sodium potassium ATPase pump. The thiazides and thiazide-like diuretics inhibits this sodium chloride symporter, thereby it reduces the reabsorption of sodium and chloride. Thus, it promotes the excretion of sodium chloride, but it reduces the excretion of calcium. That is why it results in hypercalcemia. So, it can be safely used in patients with osteoporosis because it does not increases the excretion of calcium. Actually, it helps to retain calcium in body. High sodium load reaching the distal convoluted tubule will lead to increased excretion of potassium. These are agents given only orally. Drugs like chlorthalidone has longest duration of action. Third one, weak or adjuvant diuretics. These can be potassium sparing diuretic. The site of action is collecting tubule. There is a channel which is known as epithelial sodium channel, which allows the influx of sodium ions into the epithelium, and this sodium is reabsorbed back into blood. And this reaction is mediated by aldosterone. Aldosterone increases the reabsorption of sodium and sodium into the blood. Spironolactone, which is an agent which prevents aldosterone, thereby reduces aldosterone mediated sodium reabsorption. Thereby it reduces the potassium excretion. That is why it is known as potassium sparing diuretic. Then amiloride is a direct inhibitor of epithelial sodium channel, thereby reduces the sodium reabsorption and reduces potassium loss. So aldosterone and amilorides are known as potassium sparing diuretic. It helps to prevent potassium loss. So these are used in combinations with other diuretics because it counteracts the hypokalemic effects of other diuretics like furosemide. Then carbonic anhydrase inhibitors. These agents will inhibit the enzyme carbonic anhydrase, thereby reduces the formation of H plus ion. Thus, it reduces the availability of H plus ion for sodium hydrogen exchange. Thereby, it reduces the reabsorption of sodium and promotes the excretion of sodium through urine. Thus, it results in metabolic acidosis. Other uses of carbonic anhydrase. It is used for the treatment of glaucoma because it reduces the intraocular pressure. It also reduces brain edema by decreasing the CSF formation. Then weak or adjuvant diuretics, these are osmotic diuretics. It increases the osmolality of the fluid in the lumen, thereby reduces water absorption. Thus it reduces sodium absorption also. Adverse effects of diuretics. Loop diuretics and thiazide diuretics causes electrolyte disturbances, fluid volume disturbances, and metabolic disturbances. Electrolyte disturbances are hyponatremia, hypokalemia, hypocalcemia, hypercalcemia, and hypomagnesemia. Fluid volume disturbances are hypotension and dehydration. Metabolic disturbances are hyperglycemia, hyperlipidemia, and hyperuricemia. Loop diuretics also causes ototoxicity. Thiazide diuretics causes hypercalcemia and hypersensitivity reactions. Potassium-sparing diuretics like spironolactone will lead to hyperkalemia, gynecomastia, erectile dysfunction, and menstrual irregularities. Carbonic anhydrase produces metabolic acidosis, abdominal discomfort, and bone marrow suppression. Uses of diuretics. These are used for the treatment of edema of cardiac and renal origin. Loop diuretics are the first line agents because it helps to reduce edema by increasing the excretion of sodium and water. It is also used for the treatment of pulmonary edema and also in case of hypertensive emergency. Non-diuretic uses are hypercalcemia of malignancy because it increases the excretion of calcium. Thank you.